Hi, I'm Lori De Niro, the Chief Nursing Officer for the Youngstown market at Mercy Health. Today, I'd like to share with you 2 evidence-based practice initiatives that are successfully being delivered throughout our ministry at Bon Secours Mercy Health. These 2 practice initiatives consist of purposeful hourly rounding and bedside shift report. Let me explain. Purposeful hourly rounding is a proactive, nurse-driven intervention that helps us anticipate and address patient needs. When rounding with purpose, it is intentional, meaningful, and provides a personal connection with the patient and family. It is much more than quickly eyeballing the patient, telling them to call us if needed, and then quickly marking a checkbox on the rounding sheet or whiteboard. Purposeful rounding also uses the 4 Ps along with key words. The 4 Ps, which are pain, position, potty, and placement, promote the best outcomes in a clean, comfortable, safe environment. The use of key words signifies the area of focus. Next is bedside shift report. The exchange of specific information between the off-going and oncoming nurse sandwiching the patient at the bedside provides a safe, effective, and efficient handoff. It increases trust and improves outcomes and compliance by including the patient and family in their care. Please know that these practices will empower you to deliver A+ care to every patient every time. As we begin this work, our Youngstown team is committed to the value of an evidence-based practice culture. We are supportive in giving you the training and coaching to be successful. We are all accountable and responsible for achieving these goals, and we appreciate your readiness and willingness to acquire new skills and modify your practice. Together at Mercy Health Youngstown, we are committed to providing our patients and families with A+ care. Thank you.
Hi, Brooke. How are you today?
I'm good, thanks. How are you? How was your night?
Pretty good.
Good.
Before we go to do bedside handoff, I just wanted to give you some information on Mr. Jones.
Okay.
He had a CAT scan of his chest done yesterday when he came in, and it did show a mass. And so I don't think that he knows about it yet. I don't think the doctors have discussed it with him yet.
Okay.
So hopefully when they come around today, that's something that they'll talk to him about. But in the meantime, maybe, try not to mention it until the doctors
I'll
see
wait for
him.
Dr. Goodyear.
Okay. All right. Sounds good. Are you ready to go meet him?
I am, yes.
Okay.
Thank you.
Mr. Jones, it's
Hello.
Jamie, your nurse. How
Hi.
are you?
Good.
Hello. This is Brooke. She's going to be the nurse taking over for me today.
Okay.
Very nice to meet you.
So we're going to go ahead and just give her a little update on everything that's been going on. Is it okay for me to give her information in front of your wife, Linda?
Mm-hmm.
Okay. And then if you have anything that you need to add or anything you'd like to say, feel free to chime in.
Okay.
Okay. So we're just going to take a look at your armbands. So we got Ben Jones. And then can you give me your date of birth?
5/17/61.
Okay. And he is a level 3 fall risk because he does get up with a walker. So his bed alarm is on, but he is good about calling for help before he gets up. And he has an allergy band because he has an allergy to penicillin.
Okay.
So Mr. Jones has a history of diabetes, hypothyroid, DVTs, and AFib. He came in yesterday for shortness of breath, a 10-pound weight gain in 2 weeks, and increased swelling to his legs. His BNP on admission was 12,000, which is actually up from his previous admission. It was only about 6,000. So they have Dr. Goodyear as his attending doctor and Dr. Cassis George as his heart failure doctor. So they have him currently on a Bumex strip. It's going at 0.5 milligrams per hour or 5 cc's an hour.
Okay.
So if you want to look, and I've already cleared the channel for your shift, so
Perfect.
it's
Thank you.
everything for you. And then he is daily weights and I's and O's. So he has been using his urinal. He knows that we have to measure it before it gets emptied. And then his daily weight, he gets up to the bedside scale. Because he can stand good, and it showed that he had a 2-pound weight loss from yesterday.
Okay.
So-
Mr. Jones, have you been weighing yourself at home?
Yes.
Oh, good. Every day.
Okay.
He is also on a low sodium diet, and they have him on a 1,500 milliliter fluid restriction. So we have the fluid restriction sign on the board, so he knows how many milliliters he's allowed to drink with each shift. And he has his fluid restriction cup. He's very compliant, which is nice, and he lets us know whenever he drinks something how much he's taking in.
Perfect.
So that's very good for him to do. Then he also, his lungs have been good. Lungs have sounded good. Hasn't really had a cough. He does not wear oxygen at home, but he has required 2 liters here. He's been like 92, 93%. So that's what we made part of his goal for the day, was to try to get him off that oxygen. He's still a little short of breath with activity, so we've left him on that oxygen. And then his vital signs have been great. Last blood pressure was 130 over 85. Heart rate is 74. He's sinus rhythm on the monitor. 98.4 is his temperature, and like I said, he's 94% on the 2 liters of oxygen.
Awesome. Mr. Jones, are you feeling better since you came into the hospital?
Yeah, I am.
Very
Yeah.
good, very good. It sounds like this Bumex is working. Are you very familiar with the Bumex?
No, not really.
Okay, Bumex, I put it up here on your board as a medication since it's new to you that we want to teach you about.
Okay.
And it's a diuretic. It helps take that extra fluid that you're holding onto off. So your breathing should improve as that fluid comes off. Your breathing is feeling much better then?
Mm-hmm.
Good. Hopefully our goal then can be accomplished and we can get you off that oxygen today.
Okay, cool.
And the doctors have also ordered an ultrasound of your heart just to check the structure of your heart and your valves. It's called an echocardiogram, so that will be done some point today. And we'll try to let you know if we get a time for that.
Okay, excellent.
Awesome.
Now, he has had a little bit of issue with a pressure sore on his heel because he does have diabetes. So if you want to take a look, we can. Is it okay if we take a look at your heel?
Yeah, that's fine.
Okay.
I'm going to lift up here.
And there is daily dressing, or it's not a daily dressing change, but it's the Mepalex.
Okay.
It's every 3 days and as needed, but we have to assess it every shift just so we can document what the wound looks like.
It looks really good right now, so I'll make sure to check that again later.
Not draining, nothing, no odors or anything coming from it. Okay, so then Brooke, she could put her name up there for you. And
I'll have the same phone number that Jamie had today. So
Okay, great.
if you need anything at all, you can call me at 8182.
Okay.
Do you have any questions for me right now, Mr. Jones?
No, I think I'm good.
Okay, I will be back every hour to check on you, but if you need me before, you can always call. And my name is Brooke, okay?
All right.
It was very nice to meet you as well, Linda. Thank you.
all right, well, nice having you today. I hope you have a good rest of your day.
All right, thanks.
All
you
right,
too.
good luck
So
with
nice
everything.
to meet you both. I'll be back.
Bye-bye.
Thank you.
Bye.
Hi, Mr. Ben.
Hello.
It's Tabby, your nurse.
Hi.
I'm just here to do hourly rounding. So you have some family in the room. Is it okay if I speak freely in front
Yeah,
of her?
that's fine.
Okay, good. How's your pain right now?
Good.
Good. Are you comfortable?
Yes, ma'am.
Okay. Did you need to go to the bathroom while I'm here?
Oh, no, I'm all right.
Okay, good. Just gonna make sure your bed's down. And your bed alarm's on. Somebody will be back in about an hour to check on you. If you need anything before then, if you could just push the red light.
Okay.
Somebody from my care team will be back in about an hour to check on you, okay?
All right, sounds good.
Okay, thank you very much.
You're welcome.
Can you tell me when Dr. Goodyear will be?
Yeah, absolutely. Dr. Goodyear's on the unit right now, so he should be back. He should be in here momentarily. Okay? You're welcome. Thanks, Ben. You need anything else?
No, I'm good. Thank
Okay,
you.
thanks.